Honorable Mwanginyaga, MCA Kaibaga, and Majority Leader.
And I'm James Mogishoke, representing Engineer Ward, the Minority Leader.
I'm Honorable Mary Kabiro, the Majority Chief Whip from Ruri Ward.
Yeah, probably members, you would have declared whether you've got any interest in relation to the nominee.
Through the chair, I've never met, never seen Juliana. I'm seeing her for the first time, so I have no interest.
Just met her today, so no interest. I'm Ibrahim Mwangimaina, representing Mwogalo Ward, the Minority Whip. No conflict of interest.
Good afternoon. I'm Honorable Sasha Wamai, the Deputy Minority Leader, and Chair, I have no interest.
Thank you.
Honorable Karo Jarara from Oljororok, no interest.
Paolo Gachamambaire is my name, representing great people of Kipipiri. I'm the Chair Health. I'm interested more on health. So I have not personal interest, I have public interest to see whether I have a very good able CCM. Thank you.
Thank you. Thank you, honorable members. Thank you, Secretariat. We can proceed with the honorable DS.
My name is Chege Gadrimo, member of County Assembly for Geta and the Deputy Speaker. Chair, I'm meeting Madam Juliana for the first time, and therefore I have no conflicting interests.
Thank you, honorable DS. And my name is Honorable Ashira Iganjo. By the grace of God, I'm the Speaker of Nyandarua County Assembly, and equally, I've got no interest. You see Juliana? Juliana Tsinanga.
Yes.
Now, Juliana Tsinanga, I kindly request you to briefly go through the questionnaire which you have filled. At the same time, you can start with a brief introduction of yourself. You can proceed.
Thank you, Mr. Speaker and honorable members. Just to repeat, my name is Juliana Tsinanga. I've applied for the position of County Executive Member of Health Services in Nyandarua County. Born in 1972 in Machakos County. I'm married. I'm mother of 4 adults. I currently working at Kenyatta National Hospital. I have a work experience of about 29 years. Majorly, I've worked in Kenyatta National Hospital in several departments. But in the year 2019, I was sent to the start of the Mwai Kibaki Hospital. I was there for about 4.5 years, where we started from a very low bed occupancy and also very low patient population. But as I was leaving Odaya in the year 2024, the occupancy increased to between 65 and 75%. We were able to establish quite a number of infrastructure. Initially, when we went there, there was no mortuary, there was no oxygen plant, there was no laundry. But while there, through the support of the national government, we were able to put up those very important infrastructure. The number of HR also increased from about 214 to above 500. The budget also, we were able to increase the own generated revenue. Initially, when we started, we were only generating about 21 million. By the time I was going back to the main hospital, we were at 522 million. So there's so much we did in Mwai Kibaki Hospital. Other than that, I'm also a PhD student pursuing strategic management and information at Daystar University. I'm a holder of Masters in Business Administration from the same university. I did my Bachelor of Science in Nursing from Kemo University. Before I went for the Bachelor of Science, I done a diploma and a higher diploma at Kenya Medical Training College and Kenyatta National Hospital, respectively. Yeah, I did my Form 4 in 1990 at Machakos Girls Secondary School. My primary in Kiatuni, which is in Machakos County. And what I can say in summary, our passion for what I do. I've been able to achieve quite a lot in the health sector. And I would say I'm an all-round officer, having trained as a nurse, now in leadership position. I'm also an auditor in quality management systems. I've been trained in disaster management, trained in emotional intelligence, among other short courses I've undertaken. In the year 2012, I was honored by the late President Mwai Kibaki with an HSC because of my work at Kenyatta National Hospital. That time, I was very active, and I'm still a member of the Disaster Management Committee. And you remember there was that fire which came about because of that, the pipeline, and so many Kenyans were affected. And so my outstanding performance caught the attention of the executive management of Kenyatta National Hospital, and they were able now to forward my name for recognition. In short, that's how I can introduce myself. And as I come in here, I have a passion to serve Nyandarua people. My vision is to ensure that together with the team, if approved by this committee, we are going to set up an exemplary health system which is resilient, accessible, affordable, and high quality based on the needs of the people of Nyandarua. I've also noted that Nyandarua is highly agricultural county, and also there is the issue of agrochemical, which also have an effect on the health status of the people of Nyandarua. And that's why we are getting quite a number of non-communicable diseases. And so that is an area I will collaborate. One, if approved by the committee, with the CEC member who is dealing with agriculture. I will also work with the team to ensure that
maybe you're quite out of context. I just needed a brief introduction of not what you'll do, because members will be posing those questions.
Thank you.
And you'll have an opportunity to respond to that. Maybe out of interest, what was your position at Mwai Kibaki Hospital?
Acting Director, Clinical and Nursing Services.
Okay, thank you. I think maybe to that point we can proceed to honorable members. I hope you've gone through the questionnaire that you had filled. So honorable members, we'll now field additional thematic questions to the nominee as we had earlier agreed. Yes, honorable Majority Leader.
Juliana, it is of interest that I'd wish to know how, now that you have applied for a position whereby you'll be interacting with politicians, because indeed it's also like a management position. There before, throughout your career, you have been, I can see from your CV, you have been dealing with the ordinary Kenyans and sick people and the rest. But now, the position you have applied for, you'll be interacting with politicians. I would wish to know, how do you intend to relate and to absorb the pressure that comes with that position, because it's also a very volatile position, going by what has transpired within some years that have passed. Two, I'd wish to know, are you aware of the rules governing both the county and national health sector? And if so, please name them and explain their objectives. And lastly, what is your understanding of universal health coverage, and what do you intend to do to achieve it in this county? Thank you.
Thank you, Your Honor. To answer your first question, interaction with the politicians. Yes, I've been a civil servant for most of my working time, but in collaboration, as I worked in Kenyatta National Hospital and also in Mwai Kibaki Hospital, we had interactions with the members of parliament, and also in Nyeri we were working closely together with the county government of Nyeri. So we need each other. As a civil servant and now coming to the county where I'm dealing with the politicians, I will need to collaborate with them because there's so much I need to learn from them. And I'll be there also to offer technical guidance where necessary. Why I need the politician, they're the ones who are making the laws of the land. And as if approved as a county executive member of health services, I will be required to do cabinet memos, which will go to the assembly and which will be discussed. And so I will need to collaborate. And when called upon, I'll need to present myself to explain issues to do with health and also to seek for the support from the politicians. And I'll be more than willing to work with the politicians because we are serving the same population. And they present the interest of the people of Nyandarua County, of which I'll be serving. Number two, on the laws governing the county and the national government, there are quite a number. First is the Constitution, which was promulgated in the year 2010. That is the supreme law of the land, and it defines and guides on what needs to be done at any given time. There is the aspect of the devolution, which is in the Constitution, and some functions have been devolved to the county. To name, health is one of them, agriculture, livestock, among others. Then there is the act which were recently enacted in relation to health. That is the Digital Health Act, which is looking at digitalizing the services in the county health services to make it more efficient, more effective, and accountable. There is the FIF Act, which is looking at streaming back the funds which have been generated by the health facilities. You plow them back so that at least they can be used to help the county, the facility grow in terms of resources and infrastructure. Then there is the Social Health Act, which looking at the well-being, taking care of the medical bills and health services for the mwananchi. And this is currently we are getting it from the salaried members, public servants, but I know the government is in the process of looking at ways in which salaried members can get to this. And then there's the Primary Health Care Act, which is looking at the grassroots, how we can do preventative and promotion services so that at least we are able to catch diseases early in advance to be able to prevent them from becoming chronic. Then there's the number 3, there's the aspect of SHA, Social Health Authority. Social Health Authority is an agency which has been tasked by the government to manage the health insurance issues in the country, to protect the mwananchi from suffering from financial hardship. And in that Social Health Authority, we have the primary health care, which is taking care of the preventive and promotive and maternal child health. Then we have the critical, emergency, and chronic, taking care of the emergency, critical cases, and chronic cases. This is wholly funded by the Exchequer, the same with the primary health care. Then now we have the social health, which is taking care of the whole aspect of health. This is funded by the salaried and the non-salaried Kenyans. Thank you.
Yeah, maybe before I proceed with the minority, I'll first come to the DS, because it's dealing more with basic than I come to minority.
Madam Juliana, do you mind pronouncing your second name and the third name? If you don't mind, just pronounce it in a layman's language where we come from different communities, kindly, so that I can call by your right names.
Sioweo Sinanga.
Sioweo Sinanga. Good, thank you.
Is it Sinanga or Sinyanga? Sinanga.
Sinanga. Would I be right if I called you Mrs. Sinanga?
You're right.
Okay.
Yes.
So, Madam Sinanga, how are you?
Thank you.
With a lot of appreciation, I note that you come from Machakos County, married in Vihiga County, and interested to work in Nyandarua County. Quite nationalistic of you and very interesting. And I wish you well. So, in that regard, I know that some information may be a bit limited, but having interest to work in Nyandarua County, do you have an idea how many wards are in Nyandarua County?
Yes, I've done a bit of background check, because if I have an interest in working in a county, it's always good to know what is happening. So I know it has 25 wards and it has 5 sub-county.
Well, great. And still on that note, do you have an idea of how many health facilities we have without necessarily grading them into the levels? How many generally?
Yes, I'm aware we have about 87 facilities. That is both government and faith-based facilities. And we have quite a number of private facilities, and we have 1 NGO facility.
Good. I note that in answering the earlier questions, you have explained the structures in the government and matters of healthcare, and but I would wish to ask you one question. Briefly explain the structure of the county government and the roles of its two arms of government.
Thank you, sir. Okay. To explain on the structure of the county government, I know the county government is headed by the governor, who is deputized by a deputy governor, and we have two levels, that is the executive and the legislature. The legislature being the county assembly, and the executive being the governor and the his executive team. So for the executive team is to ensure that they develop policies and procedures based on the needs of the people of Nyandarua. And the legislature, which is the county assembly, is to make laws, yes, and guide and oversee the executive also.
Thank you. Mrs. Nanga, yours is a highly professional field. And with a precision, I note you are also highly qualified. Maybe what informs promotion and job tasking in that health sector? And another question to that is that how do you react if you found a situation where less qualified, diploma holders, are ranked above highly qualified like masters, and how do you react, and how do you come in such a situation as now the manager of that sector?
Thank you. Just to react to your question on issues of promotion. Yeah, promotions are supposed to be merit-based and also competence, in such a way that it is ranked and the specification of a job and a level. So like, if I can use an example of my current facility, there's an HR manual policy which guides on how the promotion will be done. And it will be my pleasure if I'm approved, and if there is a manual or a policy in existence, to look through with my team and see whether we can streamline to that, so that you can only be promoted when you qualify. And in the event that of job tasking, it also goes with your qualification and also other skills which have been acquired over time. So that maybe I could be a nurse, but over time I've undergone some training, maybe on disaster management, infection prevention. Maybe I can be given the job of maybe being the leader of infection control in a facility. So that skill you've acquired over time now gives you an advantage of, and also gives the management the confidence to give you that task because you qualified and you're able to deliver. In the event that I get a less qualified officer who is occupying an higher position, of course, it would be a dilemma. It is a dilemma, but an action has to be taken, because I look at it. Maybe you are a diploma holder, and you've been given the end of department, of which the qualification you're supposed to have maybe master's level. I look at it at two levels. Of course, we look at the process. How was the process done? Was it the right procedure followed? If not, then now we have to go back to the right procedure, and also with respect to the officer whom we are affecting, because they also need to be informed the decision which needs to be taken. Yes.
Thank you, Mrs. Nanga. Wish you well. Chair, I'm through. Thank you.
Thank you, Honorable. Yes, we can proceed with the Honorable Minority.
Thank you, Juliana. I have two sets of documents that talk of your age, and there's some discrepancies. One that is a product of the Public Service Board, which says that you are 56 years old, and your identity card, which says in my calculation that you're 53 years old. Which one do we rely on?
No, I'm 53 years. I'm 53 years old. I think it was an error. Sorry for that.
Okay. I hear you have 29 years of experience.
Yes.
SHA and SHA have just come the other day, so I'm sure you have 28 years of experience with NHIF. What, in your opinion, was so wrong with NHIF that it needed to be changed?
Okay, thank you, Your Honor. Yes, I have 28 years of experience with NHIF. To a greater extent, we interacted with NHIF. And based on my opinion, one issue about NHIF, and now that I was working in a public facility, there was more inclination on the private sector. So reimbursement could be done more to the private sector, and the public sector would wait for quite a while. There was also the aspect of honoring claims. I know we dealt with them to some extent as I was working in the private wing of Kenyatta National Hospital and Odaya. And sometimes the claims could not match our claims. So those the discrepancies could also affect how much we're being reimbursed. Yes, that is the opinion I can give. Thank you.
Because of those majorly issues, we as a country made a policy direction that moved us now to SHE and SHA. In your assessment, and don't answer this question as a civil servant, because you still is. Answer it as a Kenyan. In your assessment, and in consideration, first of all, are you aware that about 600 private outlets are not giving us services using SHE and SHA?
Somehow.
You are aware?
Yes.
In your assessment, do you think that the time between the movement from NHIF and the SHE and SHA thing, do you think there was a gap? Do you think there was a problem? As a 29-year person of experience, when the government was making this and what is enshrined in our constitution about public participation, were you in any way involved in making a determination that the movement between NHIF and SHA is okay, and you okayed it at a personal level?
As a Kenyan, I would say, and from what I'm experiencing with SHIF and SHA, that there was a gap. And the gap is public engagement, communication, and education, and also participation. Number two, there's also the aspect of pilot testing. That one never took up, because if there's pilot, you learn the gaps, and as you continue rolling out, then you improve on the process. That's what I can say.
As you talk about the pilot test, are you aware that we did a pilot test in Nyeri, Kisumu, and Machakos, and it is in record that it failed? And even after having failed, the government went ahead and imposed the SHA thing. are you aware that in the first place that there was those 3 counties where it was piloted and it failed?
Yes, I'm aware. And
And,
just before I went to Moi Kibaki, they piloted with Nyeri County, and it has a lot of issues. It had a lot of issues.
So you are agreeing with me that this is a bad idea?
I may not say it's a bad idea. We need together. We need to work around it so that the people of Kenya and Nyandarua can benefit. We give our input to this.
Today, quite a number of private hospitals which are within Nyandarua are not giving service. And if they give service, they will require us to pay. Assuming that you are approved, what would be your immediate thing to do between the date of your approval and that kind of a time when the government is able to sort out their differences between them and the private sector? What is this stopgap measure that you're going to put in place to ensure that our patients are taken care of and that they are safe wherever they are?
Okay, yes, I'm aware that the private facilities stopped giving services on the aspect of SHA, and if I'm approved by this committee, 2 things I need to do. Of course, I know the county is also has issues with staffing, so it also becomes very hard for me to stretch the few staff who are working in the public to extend the services to the majority. But yes, we can say we have staffing issues, but we also need to look at the productivity. And I'm aware there is a cabinet memo to this house, which I will persuade and follow up so that at least we can engage health workers on local basis so that we could be able to see more Nyandaruans. Thank you.
I'm sure from your work, 29 years experience, you must have heard of the Intergovernmental Participatory Agreement. Yes. Has Nyandarua signed such an agreement with the national government?
I know several counties have signed, but I might not commit to say for sure I know whether.
I think it's a good idea to sign it.
I think it is. So
Have
that
you
we can.
checked on
For health sector, I look at it as a good thing because we need to collaborate with the national government on issues of resource.
Do you agree at the terms with which those agreements have been set? Because you know when you are signing an agreement, there are terms that are there, and there is give and take between the parties which are signing agreements. Have you read the terms of those agreements of the IPA, and would you advise the governor of Nyandarua if he has not signed to sign?
I will request, now that I've not gone through that document, I will go through the document and make a judgment on it so that I'm able to advise the governor.
Once you are approved, would you do a first call of asking the people of Nyandarua to sign into SHA and SHA?
I think it's a good thing. For me, it's a good thing.
You would do it?
Yes.
What will you do about the problem with the data systems, where in between a transaction it drops and then you have to wait for 4 hours and the end result is pay or we cannot give you service?
I think it's more engagement with the national government, automating our systems.
Do you think the national government is collaborative enough? Who will you be calling to tell the data has fallen?
Sorry?
Who will you be calling to tell that you have a line of 60 patients at the JM hospital and the system is not working? Who will you call for it to be addressed?
Of course, I will work with the several arms of government within the county so that also they can help me to push for an action to be done.
Okay, I agree to an extent that maybe it is statutory. What is the greatest distinction between SHA and NHIF?
SHA is the Social Health Authority, so it's the body that governs the funds, the several funds which have been outlined by the government. Yes, so it's the agency which manages. And then the Social Health Insurance Fund is a fund which is now used to address the health issues through payment to the insurance.
You think it was necessary to have two different funds just dealing with the same thing, different namings and different elaborations? You considering the wage bill of this country, considering the problems we are having like left and center, do you think it was a good idea to address health in different foras, creating different outfits and spending? How much money are we spending on the shisha in terms of billions to transit from NHIF to SHA? Was it worth the cost?
I look at it, and when we look at management, project management, sometimes you can improve on what is existing other than starting a new outfit altogether.
You think that is what we should have done?
That's what I think.
And I agree with you. I am looking at, of course, I'm not going to ask you how much money you're being paid as terms of a salary, but I would want to ask you whether you are aware what kind of salary you expect as CCM. You have checked it?
Yes, I have checked.
Against what you are earning?
The difference is very.
So you think it will be okay to leave a work which you have worked for all 29 years and join a new one where the remunerations are almost same, if not too much engaging? What is the motivation?
Service to humanity.
You have been serving people at a more engaging level. The nurse in charge, the patients, everyday new people, helping a lot of people. What is the motivation of this other service?
You see, life is about learning and also exploring other. Now that I'm 29, I've worked for 29 years. I feel I've grown in KNH, I've served, have learned, and that skill which I've learned from KNH, I can use it to develop and build other facilities and other centers.
Agreed. You follow national level politics, international level politics, and you know that Donald Trump, the President of the United States of America, has a serious policy shift, especially touching on USAID. And you know that as a country, and specifically as a county government, we have specific programs that have been running under the funding of USAID. What is this that you want to do now to bridge the gap that is going to be left by the policy administration of Donald Trump?
I look at it, and you'll allow me to say this. Nyandarua is an agricultural county, and it's a rich county. And we can collaborate and see how we can expand our internal revenue generation to make it better for the people of county. Number two, yes, and especially at the hospital levels, we need to recognize the revenues and the services we are offering to the people. Because if we don't charge, for example, if we've done a procedure for a patient, then we can't claim that for reimbursement. So those are the areas we need to strengthen. And also, as I work, if approved by this committee, as I work with my team and my other peers, we will explore other ways of revenue generation. Then, yes, the President of the United States of America has made those pronouncements. We still have other development partners. We will collaborate. We will seek for collaboration with other development partners. We will also lobby with the Minister of Health to give us grants, maybe conditional grants for coming up in infrastructure and also support. And also we have philanthropists in this country.
That's okay. I once in a while visit private hospital, and I know you have a good experience now of KNHS. It has its own share of good and bad. Most of these is sometimes a little negative. I go to a private hospital, I have clarity of what I do in terms of the time it takes me between the triage, moving to consultation, moving to seeing a doctor, then moving to either a pharmacy or to a laboratory. I have clarity of that time, and when I take longer than necessary, I have somebody coming to explain why it's taking a little bit of time. Do you think that is something that can be effected at public hospitals? And do you find it okay when you walk along the casualty area and you have elderly women sleeping on very rough coaches? I don't know whether you also want to improve the coaches that you put at the receptions. Does it affect you? And do you have a clarity of how you would ensure that our hospitals have a structure, a system that allows systematic flow of patients from the first stage to the last stage?
Thank you for that question. Yes, I know sometimes it is not very good what people go through in our public facilities, but I can assure you that if I'm approved for this position, those are my priorities, and I need to work with the members of staff. We also need to put some budget also to take them for some training on issues customer care. We also need to work on issues of coming up with a quality management system checks. I know for Odaya was a public entity, and when I went there, we streamlined on the processes. In fact, when we requested for ISO certification, we got it the first attempt. So it's just coming up with the procedures, policies, guidelines, and making sure the members of staff adhere to them. First, they know about them, because sometimes you can make procedures and you just keep them in the shelves, but you need to engage.
Thank you. The very last one, and it is a very simple one. On Odaya, you said you started with the occupancy that was very low,
Yes.
and by the time you're leaving, the occupancy was very high.
Mm.
How do you measure success of a hospital? Is it the number of patients who have now become sick and you have treated? Are you happy when you have more patients in the hospital? Do you measure it as success? Or are you okay when you have fewer, meaning the health of the nation and is good? How do you measure success of a hospital in bed occupancy?
For a new hospital, because the object of coming up with a new hospital is to take care of patients. And I know people have to be sick. So it will be very unprocedural to come up, the government comes up with a facility and patients or population shuns away from getting to that facility. It means your services, the quality of your services are not good. And that's why people will go to other facilities. Yes.
Yeah, okay, Chair. Thank you.
Mishuki, we can proceed, Honorable Ibrahim.
Okay, thank you, Chair. I have two questions, which are very quick. Madam Juliana, I've heard you are aware that we have about 87 hospitals
of the facilities within this county. Are you aware which level do we have the highest level of hospitals in this county? How many are they? The highest one? Then how are their current status and what can be done to improve the quality service within the county? Thank you.
Thank you, Your Honor. Yes, I know we have two major hospitals in the county at JM Kariuki Hospital is the county referral hospital at level 5. And then we have Engineer, which is a level 4 facility. And then others at different levels. So those are the two major facilities in the county. Of course, I'm aware that there's the aspect of infrastructure, some incomplete infrastructure, which needs to be supported. I'm also informed that the level of staffing is not adequate. So as I come in and working with this house, this assembly, of course, I'll be reaching out for support and approval in terms of engaging more healthcare workers, even if it's not on a permanent basis, maybe on local basis, just to fill in the gap. As also we pursue the Public Service Board, the County Public Service Board, to employ, based on the budget, to give a priority to health department. On the issue of the infrastructure, I know it's supposed to be a capital investment. Of course, I'm not privy of the budget as of now, but we look at the budget and see what are the priorities and see what needs to be completed faster. And then our friends, I know we have professionals in Nyandarua County. How do we partner with the professionals to see when we can do fundraising to support this? I talked about development partners and philanthropists. And also we can even also come up with an innovative way, coming up with a marathon for Nyandarua, where we can use that to fundraise some money to improve on the infrastructure. We might not do it 100%, but to some extent we can do something. Thank you.
Thank you. Chair, I'm contented.
Thank you, Honorable Ibra. We can have Honorable Matimu.
Thank you, Chair. I think I'll start by introducing myself because I was not there. I'm Stephen Mureithi from Kara Ward. My first question goes to something that the Deputy Speaker had asked about transfers or a situation whereby a diploma holder, for example, is transferred to head a department whereby we have maybe even master's holders. What can happen in such a scenario in the health facility or in the health department?
Thank you for that question. Yes, sometimes mistakes can happen intentionally and unintentionally. You get somebody who is less qualified occupying an higher position. The effect of that, there could be less motivation on the other members of staff because one, they feel that the process was not very fair, and this can affect their productivity and output. Number two, the person who is not qualified might not be able to execute their duties as is required, and it can affect the functioning of that department or facility because the guidance you're giving to your team is not informed on competency or skills. So that can be the major impact on the performance of the staff and also the facility.
Thank you because of the way you've answered that question. I want you to put it now in a scenario that the department that you're going to find has the problem that you've just mentioned, whereby we have demotivated staffs who feel that maybe transfers that were done a while ago were not merited, and they feel that they were not justified to have been transferred to wherever they are. What will you do to handle such situations?
Thank you for that question. Of course, if I'm approved by this assembly and I face such problems and challenges, I know I have a team which I'm working with. Of course, we will sit together, have a discussion, and see what action needs to be taken. Based on our findings, then we will communicate to the affected staff. Sometimes I may complain just because of lack of information or lack of knowledge, or without knowing why I was transferred. But if it is explained to me after we discuss, then I believe it's something we can sort out with my team. And I look at it, yeah, it's in my 29 years of experience, those are issues I've experienced, and we've been able to sort out them.
Maybe still on the same thought, I can finish up with that question. I want to put maybe a scenario whereby, and I'll go maybe very direct to a situation that has happened. The assembly request the department to maybe cancel some transfers that were done. The same is done today, then tomorrow, the affected people are reverted back to the position that they were in. According to the HR manual, is that right? And is that procedural? You transfer someone today, then again tomorrow you purport to transfer them back.
That might not be procedural, and I expect the two levels of government at least to talk to one another, so that when we are making decision, we are making an informed decision which we are all abide by it. So that aspect of reaching out and discussing and agreeing, so that also we don't seem like sometimes you can allow now the people you're managing, if you are not agreeing at an higher level, to manage and divide all of you. So there has to be that discussion together. And as we make decision, we are making an abiding decision from our levels.
In county governments, and if maybe you're approved to be the CCM of health, who will be in charge of transferring staff in that department?
Within the department? Within the department, of course, there is the chief officer who is assigned the day-to-day operations duties of that specific department.
Thank you. What would you take to be a proper working organogram for our health department?
For our health department, I will look at, of course, there is the CEC member, and then deputized by the chief officer. And then we come up with the directorates, one for medical services, the other one for public health services, and beneath that we are able to attach now the specific units which report to the medical services, which is basically on curative services, and the others on public health, which is more preventive and promotive. That's how I look at it.
Thank you. According to you, how many directorates should we have in our health department?
I'll look at we can from where I sit, we can have, of course, the medical services, which takes care of the doctors, the nursing procedure services, the clinical medicine services, and all that which is in line with the patient care. Then the public health, which is more promotive and curative. And then there's diagnostic, directorate of diagnostics, which takes care of the lab and the radiology services. And then there's now the pharmaceutical, which takes care of the commodities. Yes.
It's my humble prayer that if you are approved, let's see that on paper. Because as we stand, we don't have a working organogram in our health department. And I think that has been one of the problems that we are facing. What is your current position where you are?
My current position, in line of nursing, I'm a deputy chief nurse. And functionally, I am now the head of School of Nursing. KNH has a School of Nursing.
Have you been approved for the head of nursing department?
Yes.
And you're willing to overlook that and join the position that you're looking for?
As I said earlier, yes, I am willing to serve the people of Nyandarua and also to learn.
Chair, the last but not the least, what are the mitigation measures do you propose to ensure that there is no shortage of essential and unessential supplies, that is for some pharmaceutical supplies in our health facility, and that all internal loopholes are addressed? In this aspect, you'll find that there are instances whereby you find medicine has been delivered to the facility. But when you go to the counters, there's nothing. What will you do to curb the same?
I look at it first as the health department. We need to identify. We need to recheck. I know the identification is already done, but based on the needs, we need to identify our priority in terms of products and medicines which we require. Number two, we need to establish an accountable system where we are able to account for each and every syringe, each and every medicine which has been allocated. How do we do this? I know sometimes we can have wastage if we don't account for what. We need to have a system to ensure that what was delivered, we can trace it to the patient. And that requires automation. I know to some level, the county is automated. So I'll be seeking for support so that we can automate the system to be able to ensure that we can follow up these products and medicine to ensure that they're given to the patient. Number two, I know, and it's an exercise which happens in most of the hospital and especially for inpatient services, where other than issuing medicines and products to a specific patient, it is issued as a ward stock. And the chances are there could be filterage in that. So we have a system where we issue to a specific patient, and upon discharge, we are able to account whether the patient used all that, and if they were not used, there is a return procedure where you return the medicines which were not used on the patient, the syringes which were not used on the patient, and the patient is credited on that. Thank you.
Chair, just one more. Have you ever heard of an animal called CHMT?
CH?
MT. Yes.
Yes. County health management team.
Yes. How is it constituted?
I know the chair is the CEC plus the directors whom she has appointed, and then representative from all the functions and the facilities within the county.
That last part.
Yes.
How will you get this representative from the various departments?
Oh, of course, I'm assuming, and if it's not in place, every department or unit, we need to have the leader of that unit, and that is the person who will represent the needs of that unit.
Thank you. Maybe my parting shot, one thing that I would request, because I think we've been very passionate on matters health, if approved by this assembly, kindly, there's something that has been happening in our health department, an animal called transfers on need basis. But when you really look at them critically, it tends to be a mode of punishment to maybe those staff who don't toe the lines. So I would wish that when you get to that department, kindly ensure that if approved, you bring order, and more so on matters transfer, because it's one of the things that has really ailed that department, and is one of the main problem in the health department. Thank you, Chair.
Thank you.
Honorable Sasha.
Thank you, Honorable Chair. So, I'm happy that you're a lady. You have vast years of experience, and by that you understand how sensitive healthcare is, and especially to a common person who is not able to access insurance, who cannot be able to pay premium rates for insurance, and is relying on the SHA and SHA. That conversation is going all over. So, because you answered that, I would just like to know, if you get this position, what are your 3 top priority areas in that docket?
My 3 priorities in that area. 1, we have to ensure that there's quality in the care we are delivering to our people in Nyandarua County. Number 2, I can't run alone, so I need to form a team which has the same objective as my objective, to give the best to the county. And number 3, I will work with the administrative arm to ensure that health is delivered, it is accessible, and it is resilient. Even if I exit the county, it still stands. Thank you.
All right. This team you will form, we have an issue of bloated wage bill. Where will you get the team members, or do you mean your departmental officials?
The same team which is in existence is the team I will work with.
All right, that is well understood. My second question is, in light of the public outcry over the state of health services, how do you plan to ensure more timely services, service delivery, and increased public satisfaction? Because there is so much outcry out there in terms of health services delivery. What do you plan to do?
Okay, thank you for that question. Number 1, the team which I will find on the ground, and the team which will come on board as I continue, will have to focus on the customer. Customer focus is number 1. And how do we do this? we have to continue talking to our team. We have to continue engaging with the team to show them the importance of that customer. We need to continually analyze and evaluate the needs of this customer so that we are able to peg the priority of our service to that. We need to give feedback to our customer at any given time. Maybe a customer will not be happy with a certain service. Maybe she has put it in a complaint register. It's always good to give a feedback. Number two, the leadership support, very critical. I will not leave my team to run alone just to be giving me report. I have to be with them whenever and wherever is necessary. I need to work with them. I need to visit with them. I need to hear their issues. I need to explain what we are able to do and what we are doing and the support we require from the other arms of government. And then number four, we need also to see as we move forward and as we mobilize more revenue, we need to come up with some of the national and international standards, adherence. We need to get a firm which will be checking us. Because if we check ourselves, sometimes we might feel we are giving our best. But if we go for ISO certification, their outline standards, we know after every 2 years they will come and check. So we will have to adhere, and that one also pushes us to give the best to the customer.
All right, my last question is on the what plan do you have in improving ambulance services and emergency response in the county? And maybe let me join two of them. The other question and my last question would be on solid waste management, which falls under your docket. And it has been a pain in the public. The public has been, has been crying on the management. Okay, there have been a serious issue on the same. So how do you really plan to deal with that issue, considering the issue of land acquisition, where the dumping sites will be located, the health hazard that we pose to the public, an overhaul on how you'll deal with that, noting that it is a very serious issue in the county.
Thank you. On issues of ambulance services and to some extent referral from the county and to the county. Of course, if I'm approved by this assembly, I need to take count of the number of ambulances which are serving the county and how many are in function, how many are not functional, and maybe we need to come up with a way of managing the ambulance, a centralized way of managing the ambulance, so that we are able to track at any given time where is this ambulance, so that at least we are able to know which facility requires an ambulance, and we can send that ambulance to help the client. We will also work with the counties which are our neighbors, the Nakuru, because sometimes you might find all the ambulances are out, maybe sorting out patients. But if we are in good books with Nakuru County, Naivasha, facility, Nyeri, we can have a way of, if it's a patient who is at the border of Nyeri, we can talk to the Nyeri County ambulance services coordinators and help us pick that patient. And then number three, so that also, I know the government has a fleet management system. We will also see what we can borrow from that, so that at any given time, our ambulances are in good shape and they have the necessary fuel required to sort out our patient. And also there's a private, like the E+, we can also collaborate with them. Thank you. about the solid waste. Yeah, I know this is a public health issue. More so when it comes to hospital waste, because it is assumed to be infected. So you can't just let it lie wherever. There is the aspect of having county incineration services. So that is an area I will pursue, so that at least we assure all the waste which are generated in the hospitals, they don't become a danger to the population.
Maybe to just interject, because the public is listening to you.
Yes.
The word is a bit technical. What do you mean by that?
Incinerator is a machine which is used to burn waste at very high temperatures, so that now it becomes non-infectious. So if the county does not have an incinerator, it's something I'll be bringing to this assembly, so that at least we can see how we will acquire one or we will outsource the services. Then, other than the clinical waste, I'm looking at being a farming zone. There's also what is produced by the traders, by the farmers. So that one requires a discussion, maybe with the CEC of Agriculture, the county representatives in terms of the wards, and the people of Nyandarua, so that we look for a solution together. Because we can have an innovative way of converting that to organic fertilizer, which can be used back in our farms. Thank you.
Thank you, Chair. I think my questions are well answered. I wish you all the best.
Thank you.
Thank you, Honorable Jarana.
Ms. Juliana, what is your understanding of Facility Improvement Financing Act, and how do you intend to roll out the implementation of the Act? And how do you plan to integrate community-based health education initiative to enhance preventive care among Nyandarua's residents?
Thank you, Your Honor. The FIF Act is an act which guides on that whatever revenue is generated in a facility, be it a health center, dispensary, it is plowed back to that specific facility to sort out their issues, their emerging needs in terms of resources, yes, to improve that facility. Number two, it was community health initiatives. Sorry. Yeah, on community health initiatives, I'm aware there are community health promoters, and they are at the first and the lowest level of care, where they're supposed to engage with the community, able to identify early diagnosis, able to health educate, able to refer to the next level, which is a dispensary. So if I'm approved by this House, I need to work with that level of promoters. One, we need to equip them with knowledge. We need to equip them with the necessary tools to be able to undertake their job. And also we need to engage even with the administrators within those levels, so that at least we are able to reach the people of Nyandarua and have engagement with them. Also having medical outreaches and medical camps, that is a level of engaging with them. And also collaborating, like with my employer, KNH, to come on the ground to support medical camps. I have an MOU with Mwai Kibaki Hospital to see how we can reach out to the people, go run a surgical camp at that level, go do a screening camp at that level, so that we are able to identify these diseases early and putting the necessary measures in place. Thank you.
Honorable Ngeshi.
Thank you, Chair. Mine is some few questions. What is aiding Nyandarua?
Nyandarua, being an agricultural county, there's quite a lot of agrochemicals which are used, and this has led to an increased number of non-communicable diseases, which are diabetes, cardiovascular, and cancers. And cancers. That is one of the major health issues in Nyandarua. When it comes to the nutrition aspect, there is also the aspect of standardness in the children, and also obesity in the adult. Majorly because of the lifestyle, because of the agricultural activities, and to some extent, it is also hereditary.
So you've come to solve non-communicable disease and started growth.
That is one of the major issues, because that is the major issue in terms of health, but also there are other issues. The issues of the facilities, are they sufficient for the population? The issue of the commodities and products, are they sufficient for the population? So as I engage, and once approved, those are the issues I will be engaging with the people and trying to work with the team to address.
How many days or months or years remaining to the next general election?
2 years.
2 years?
Yes. And a few months.
You see, the person who is needed, somebody who is not coming to plan, is to actualize.
Sure.
And where you sit, you've mentioned something to do with facilities.
Yes.
How many facilities do we have?
87.
Mention 5.
I know there's JM, there's engineer, there's Olokarao. The others I will be guessing. I'll know them with time.
Yeah? You see, what is aiding Nyandarua health sector? I didn't respond to me on that one. What is aiding? What is the problem?
The problem in health sector?
Yeah, in Nyandarua, to be specific, in Nyandarua.
Okay. Other than the non-communicable diseases, there's also the aspect of financing, not sufficient enough to support the running of the facilities. Number 3, there's also this aspect of staffing, which is also a major issue. Number 4, there's also the aspect of human resource management, where I've learned from this assembly that there are rampant transfers which are demotivating the staff. Yes.
We've identified the problem. Now give us solutions.
On the issues of the human resource management, together with the team which we are going to govern the county, we will discuss and come up with the policies of transfer of staff, or strengthen the existing policies so that it is objective when we are transferring our staff and he understands why. Because I know I'm coming from a profession where after every 3 years, you can be moved to another area, so that at least for exposure and also for succession planning in case that facility does not, or the person who is there leaves. On issues of financing, yes, I'll still be presenting our needs to this assembly for approval based on the needs of the county, because we need to identify our needs, come up with a budget, and lobby to be allocated. As I also partner with other developmental partners, a philanthropist, to see whether we can raise some extra revenue in terms of support, internally generated revenue or on the generated revenue. We need to strengthen that area, so that for every procedure done, we are able to recognize that revenue, and we account for the revenue and how it is used. Then about NCDs, there are so many, there are quite a number of strategies and policies which are running both in the county and in the government. Like the County Nutrition Action Plan, it has come up with measures to mitigate issues of nutrition issues. That is an area we shall follow up to ensure they're implemented and evaluated to see whether they are meeting the objective of that. And then the other aspect is about, I think I've tackled all of them. Yeah, thank you.
Staffing, you see, you've said we have problem with the staffing.
Yeah, staffing, yeah. Staffing, yeah, I know we have.
How many staffs will be under you?
I will, if approved by this house, I'll be able to know, but for now I can't put a figure on it.
What is the gap?
The gap is in terms of what I'm told, and from the ground work I did, there are no sufficient numbers to take care, and also we don't have enough specialists to take care of our patients.
What is sufficient?
Sorry, if you could reframe the question, sir.
You said you don't know the number of staff that we are having, but you know that we need sufficient number. So I want you to tell this committee what is sufficient number.
Okay. We only had 8 patients as inpatients. And by the time I was leaving, we were seeing over 200 patients in the outpatient. Our occupancy was above 65. I was the management representative of Moi Kibaki Hospital. We initiated the process of ISO certification, and we got the certificate on first attempt. Back in KNH, I worked in private wing. I was also transferred there when the private wing was making losses, while it was supposed to be supporting the main hospital. We worked with the team, and as I was leaving to go to Moi Kibaki Hospital, we had introduced quite a number of services, that is dental services, vaccination, that is for travel, specialized clinics for the consultants. By the time I was leaving, we were making surplus. I worked in the accident and emergency department. I was part of the committee on disaster management. We were able to come up with the disaster management plan and policies for the facility, and there was an improvement on how we were dealing with the disaster. For the turnaround time in accident and emergency, patient could be in casualty for more than 24 hours. But together with the team, and for critically ill patients, we reduced the turnaround time to about 8 hours. I worked in the pediatric outpatient clinic. Immediately I did my higher diploma in emergency nursing. Initially, the flow of the patient was you come in, the registration, and then you will meet the clinical team behind the scenes. So immediately we reported with my colleagues. We started the triage system, where the first contact is with a nurse, so that you are able to categorize. Is it an emergency? Is it an urgent case? Is it a case which can wait? So that we deal with the patient. And there was reduction in mortality in that area.
So you are telling this committee that you are a team leader?
Yes, I am a team leader and also a worker.
Community health promoters.
Yes.
You know about them?
Yes, I do.
Tell us something about them.
As I had said earlier, alluded to this, the community health promoters, they are at the first level of care in the 6 levels of healthcare system in the country. And their role is screening, identification of minor ailment, and referring to the next level, which is at the dispensary, level 2. And so it's a team which, if well skilled, if well supported, will also help us to identify diseases early, and then early intervention, and we are able to improve on health status of the county population.
Now, you see, they are experiencing delays in the payment of their stipend. For the last 6 months. What do you intend to do to ensure that there is timely payment?
Still, in collaboration with this assembly, the Public Service Board, and the Minister of Health, we work together and ensure that there are timely payment to the CHPs.
Departmental Human Resource Management Advisory Committee.
Yes.
Hiyo ni gani sasa?
The Departmental Human Resource Advisory Committee is tasked with the roles and responsibility of checking on the performance of the staff, addressing the issues of indiscipline, developing policies for reward or sanction, and implementing the policies, and also working with the other bodies like the union to sort out grievance issues.
What is the qualification for one to become a member?
For one to become a member, and based on my experience in KNH, of course, the HR department is the secretariat, and the representatives of departments form that committee, part of that committee. And whenever there's a grievance involving a member, then he is allowed to have a representative, either a union member or a friend. I'm basing that on the experience I have in KNH.
CHMT.
Yes.
That was DHRMC. Now CHMT.
Yes.
What about CHMT? You had said something, but what is CHMT now?
CHMT is County Health Management Team.
What's law that governs? Do you have existing law governing the same?
I may not be aware of it, but I know they exist.
Now that you've come from national government, how many directors do we have?
Yeah.
There, up.
Oh, we have quite a number. In KNH, we have...
Not KNH.
Okay.
The national.
The national.
Umbrella. What organogram for the national?
Of course, we have a director medical service.
Mm-hmm.
We have a director public health services. We have a director in charge of diagnostics and health information. We have a director in charge of pharmaceutical services and products. And I think we have a director in charge of administrative services. And then, we also have a director under finance and administration.
Who is senior most?
Senior most in terms of ranking?
Yes.
Director medical service.
Who speaks on behalf of the nation?
It is the CS.
See, it is appointive. That is, you are appointed. Eh?
Okay.
You see, the problem with the Nyandarua, I wanted to tell you is that confusion of organogram.
Mm.
If you are not familiar
Yes.
with what goes where, flows where, that is the first confusion that we are having.
Sorry, if I may respond to your question, the spokesperson is the Director General.
We have how many Director General?
Only one.
Very well. Then when you get this job, you realize whether we have one Director General here or we have several. This is about organogram.
Sure.
Because our problem is not even it is not financing the pharmaceutical and pharmaceutical.
Mm.
It is organogram, flow of command. Like now I heard you said that CCM chairs the county health management team. He or she chairs. You will confirm with the room whether he or she should chair.
Okay.
Because now uko hapa ground. Sasa hii ni ground. You see umetoka national, it's local. Everything here is local. And I wish you well.
Thank you.
And I think we will deliberate much about this sector. And I can only wish you all the best.
Thank you.
Thank you, Chair.
Thank you. Thank you, Juliana. I'll not ask you any technical question. At least you've answered so many questions. But yes, what is that? Just one question. Please, just take less than a minute because you had.
Mrs. Tsinanga, what about the establishment, now that you'll be sitting at the cabinet level, what about the establishment of private wings in the public health facilities, especially because of those who hold insurances from private companies in improvement of the FIF? Kindly intimate on your idea on this.
Thank you. I worked in a private wing in KNH as an assistant director, and it's a good idea, and also an income generating activity. So it's something I would propose we embrace, but also there is need to have a discussion, and especially with the specialists, so that you agree on the ratios, the revenue sharing ratios. So that, because there's so much, as a facility, you will provide the infrastructure, you will provide the staffing, you will provide the utilities. So that is an area we need to look at what ratios, because what I know about most of the private facilities, they take they give the specialist 35% and they retain 65% of the revenue accumulated. But this does not include the diagnostics, because the diagnostics are for the hospital and the sale of the products and consumables. Yes, so it will be a great idea.
Okay. Just to interject on that, about SHA card holders who do not receive, they have to start the lowest level of the health care, and they happen to come to JM. Do you turn them away, or how do you handle such a situation?
Okay. If a client turns up in JM, and maybe he was supposed to seek for a treatment at the lowest level of care, maybe in a dispensary, first, before even you think of turning them away, you need to look at the level of emergency. Because if it's an emergency case, you must deal with that patient. Number two, of course, when in a level 5 hospital, the cases you're dealing are critical. You need also to engage with this client and tell them she might be, if she's to be seen in the JM, she might be forced to wait for a bit longer, because we will give priority to the critical cases. And you advise her to be prudent. They seek, if they are comfortable, they seek for treatment from those other levels. But if from the discussion they feel that they need to be seen there, they can wait, then now you can give, and then you educate them. Next time, please, these are the procedures. This is how things are supposed to flow. And then now, once you pick that and you realize it's becoming a problem, you have an engagement with CHPs and their ward administrators so that they can educate their people on the procedure.
Thank you, Chair.
Thank you, DS. Maybe, Juliana, what's your net worth?
About 30 million.
About 30 million?
Yes.
And if you know a driver and a conductor?
Sorry?
You know a driver and a conductor?
Yes.
That is in a matatu?
Yes.
Who is senior to whom?
The driver.
You know a chief and a sub-chief?
Yes.
Who is senior to whom?
Chief.
Don't you think a doctor and a nurse, when you go to manage doctors, they'll be demeaning you? A doctor and a nurse, who is senior?
Of course, in ranking, the doctor is senior.
Don't you think it's going to bring, they're going to demean you in your role? Because you're going to deal with medical doctors.
I look at it in a way that I've managed the private wing, where I was the head of clinical and nursing services, substantive. I was dealing with the doctors. It depends on how you manage, how you relate, whether the procedures are followed. Yes. So the level of interaction also matters. Yeah, because if you know your staff and you're not demeaning anybody and you're showing them how, guiding them very well, then things will flow.
So competence is not based on seniority.
Not in most cases.
It's an experience.
Experience, skills, and also exposure.
Very well. You worked for 29 years.
Yes.
As a very senior medical personnel.
I started at very low level.
Yeah,
Yes.
but you've grown to be very.
Yes.
The 29 years vis-a-vis the 30 million. Is it that you have no interest in pecuniary investment from what you earn, or?
I've not been engaged in investment. My role has been just serving.
Serving.
And, yes, I have a supportive husband, and also my children are working.
Yeah.
Mm.
You come from Machakos, and by extension, Machakos girls. Yeah?
Yes.
Who is senator for Machakos?
The current senator is, the lady name is disappearing. Kavindu.
Kavindu?
Yes.
A lady?
A lady, yes.
Who is the governor for Machakos?
Wavinya Ndeti.
A lady?
Yes.
Who is the speaker for Machakos?
The speaker, I know her, but the name is disappeared.
QC,
Yes.
So ladies are doing very well. So Machakos, we can call it Machakos Girls, even the county itself. Thank you very much. And thank you for your time. Thank you for availing yourself. And thank you, honorable members, for your time. I wish to appreciate the nominee for appearing before the committee and answering the questions fielded by the members. As I had earlier assured you, the committee and indeed the House shall fairly consider your questions and shall provide the right verdict. Thank you very much. Kindly check that you have all your original documents. And I now ask the Chair Health, that is Honorable Paul Ngesha Wambaire, to escort the nominee. But prior to that, maybe I'll give you 1 minute to say a parting shot.
Thank you, Your Honor, for giving me this opportunity to present myself before this House and this Assembly for the 13th session. I'm happy to say that it was fair. I didn't feel like I'm pushed, and I answered all the questions to my level of understanding and commitment. And as I leave, I available to serve the people of Nyandarua. If approved, I'll be working closely with this assembly, and I'll be ready to support in whatever I'm capable to do. And I will also seeking for your support as we serve the people you represent. I'll be more than willing and available to answer your questions and to seek for your support. Thank you very much.
Thank you. And maybe if you approve, because mostly you'll be dealing with these members, you address them as honorable member. For your honor, we normally use it in court to address judges.
Okay.
Thank you.
Thank you.
Honorable Ngesha.
I go with this.